Good evening, folks. Now, tonight's B is talking about long-term care wages for attendants, aides in nursing homes. So we're going to go through that with a narrative I wrote for y'all tonight. So let's get going with B, shall we? Okay, the title is Paying the People Who Hold Our Parents' Hands. In every nursing home, there is a moment that reveals the truth about long term care in America. It's rarely dramatic, more often, it's quiet. A nursing assistant kneeling to tie a resident's shoe, a whispered reassurance during a bath, a hand resting on a shoulder while someone struggles to remember their daughter's name. These small acts tender, skilled, intimate are the backbone of long-term care, and yet the people who perform them are often paid less than the cost of a single day in the facility where they work. I've spent my career in palliative care, walking alongside people in the final chapters of their lives. I have seen how the quality of those chapters depends not on technology or marble floored lobbies, but on the stability and dignity of the workforce. When wages are too low to live on, stability collapses. And when stability collapses, residents suffer. We talk about staffing shortages as if they were natural disasters. Unpredictable, unavoidable, but they are. Not, they are the predictable result of a system that asks people to do physically demanding, emotionally taxing, safety critical work. For wages that qualify them for public assistance in Pennsylvania. The median certified nursing assistant earns around 17 an hour. Many work two jobs. Some sleep in their cars between shifts. Nearly half leave the field within a year. Turnover at this scale is not just a workforce problem, it is a resident care crisis. When the CNA, who knows that Mrs. Thompson becomes confused after 4 p.m., leaves for a job at Sheets that pays $2 more an hour, then the next shift may not. Notice the early sign of delirium. When the aide who can coax Mr. Rivera to eat loses childcare and quits, his weight drops. When a facility loses 60% of its staff in a year, the people who remain are stretched thin, rushing from room to room, apologizing for delays they cannot control. We wring our hands around falls, pressure injuries, avoidable hospitalizations, and medication errors. But these are not mysteries. They are the downstream effects of poverty wage labor. The truth is simple. Paying fair wages is one of the most powerful resident safety interventions we have. Fair wages create community, continuity. Continuity creates trust. Trust creates better care. A stable workforce notices subtle changes, a new tremor, a shift in appetite, a quiet withdrawal that prevent crises. A stable workforce builds relationships that make the hardest moments gentler. A stable workforce stays. Some argue that facilities can't afford higher wages, but the cost of turnover is already staggering. Recruitment, training, agency staffing, overtime, burnout, and the cascading clinical consequences of understanding. We are paying for instability, just not in a line item. The deeper issue is structural. Medicaid reimbursement often falls below the true cost of care, especially in rural and nonprofit facilities. Without wage pass-through requirements or transparency, standards increase in public funding do not reliably reach frontline workers. Meanwhile, large corporate chains, may own may many owned by private and equity, exact profits through complex ownership structures that obscure where dollars flow. We cannot solve this with gratitude alone. We cannot solve it with pizza parties or CNA Appreciation Week. We solve it by paying people enough to stay fair wages, not charity. They are policy, they are safety, and they are respect. And they are the only way to ensure that when our parents, partners, siblings, or neighbors need help tying their shoes or remembering their daughter's name, someone will be there. Someone who knows them, someone who stays, someone who is paid enough to build a life while caring for the lives entrusted to them. Long term care is the work of holding human beings through vulnerability. It deserves a workforce that is not living in it themselves. Okay, here you go, guys. Here's the second half of B. Policy focused narrative op-ed. Long-term care wages. Here's the second title. Most effective nursing home reform is also the most overlooked. Pay people enough to stay. In long-term care, policy often feels abstract. Ratios, reimbursement formulas, regulatory thresholds, but the consequences are not abstract. They show up in the quiet moments when a resident waits too long for help to the bathroom, or when a new aide doesn't yet know that Mr. Daniels becomes anxious if his evening routine is disrupted. These moments are shaped by policy decisions made far from the bedside, especially decisions about wages. The frontline workforce, certified nurses, certified nursing assistants, dietary aides, housekeeping staff are the backbone of nursing home care. Yet in Pennsylvania, many earn wages that qualify them for public assistance. The median CNA wage hovers around 17 an hour. Turnover approaches 100% annually. Facilities spend millions on agency staffing, recruitment, and retaining. Residents pay the price in missed care, preventing injuries and avoidable hospitalizations. This is not a workforce failure, it is a policy failure. The policy problem, Medicaid rates, and accountability gaps. Most nursing homes rely heavily on Medicaid, which reimburses below the true cost of care. When rates stagnate, facilities cut the only flexible expense they have, labor. But even when states increase Medicaid funding, there is no guarantee those dollars reach frontline workers without wage pass through. Recruitment requirements or transparent reporting. Funds can be absorbed by corporate overhead, management fees, complex real estate arrangements. The result is predictable low wages, high turnover, unstable staffing, lower quality, and higher costs. Folks, when we have elderly people to worry about in facilities, think of them as your grandmother, mother, aunt, uncle. Think of them as your family member. Would you want your family member to wait for care? Would you want them would you want them to reach the bathroom without having an issue? Some nurses' aides take the fact that they have lower pay out on residents. That happens, folks. Before you think about how much you get for hours in a nursing home, think about residents. Residents come first, folks, when it comes to care. Just thought I'd throw that in for FYI. Okay, here, the bottom piece. We cannot regulate our way out of this without addressing wages, staffing, mandates. While essential will fail if the workforce cannot afford to stay. Policy solutions tie public dollars to workforce investments. States have several proven levers to stabilize the long-term care workforce. Wage pass-throughs require a portion of Medicaid rate increases to be spent directly on frontline wages. Cost reporting transparency mandate clear disclosure of how facilities allocate funds, including related party transactions. Minimum wage standards set baseline wages for CNAs and direct care staff and index to inflation, target role, and nonprofit supports. Provide transitional grants to facilities with thin margins, so wage reforms do not trigger closures. Folks, I've also seen where facilities close, so then they have to find other facilities for the residents to go to. That happens also too often, in my opinion. All right. Career ladders and training incentives pair wage increases with advancement pathways that strengthen retention. These are not radical ideas, they are evidence based interventions that states across the country already implementing. Let's see. The economic crisis. Stability saves money. Policymakers often ask whether we can afford higher wages, but the more accurate question is whether we can afford the cost of turnover. Turnover drives agency staffing premiums. Overtime costs, recruitment and onboarding expenses, high rates of falls, infections, and hospital transfers, regulatory penalties tied to quality deficiencies. Every dollar spent on turnover is a dollar not spent on care. Fair wages, reduce turnover. Reduced turnover improves quality. Improved quality lowers costs. This is not theoretical. It is documented in peer review studies. Unionization research and state level evaluations of wage pass through programs. The human case. Continuity is care. Policy debates often overlook the most important truth. Continuity is not luxury. In long term care, it is the foundation of safety. A stable workforce notices early signs of infection. A stable workforce prevents pressure injuries. And a stable workforce builds relationships that reduce behavioral distress. A stable workforce keeps people out of the hospital. When we pay people enough to stay, residents stay safer. Pennsylvania is at a crossroads. We can continue to treat long term care wages as in operational detail, or we can recognize them as the most powerful lever we have to improve resident outcomes. Policymakers should tie Medicaid increases to enforceable wage standards, strengthen transparency requirements, and support facilities that genuinely struggle to meet them. Fair wages are not just a labor policy, they are a patient safety policy, a quality improvement policy, a fiscal responsibility policy, and they are the clearest path toward a long term care system worthy of the people who depend on it and the people who show up every day to care for them. Okay, guys, that is your B for today. I will be back on later for shows. For now, Gator Wellness, take care, folks.